Hello, I'm Dr. Sudeep Koshy, Kurien, interventional cardiologist. One day I received a call from the emergency department while I was in the OPD and about a patient who was wheeled in with a heart attack. He was a patient with inferior wall myocardial infarction where the right coronary artery of the heart was blocked. And immediately he was shifted to the cath lab and we could open up the artery and stent the artery and save the patient. What was more interesting was the story the patient told me after the procedure. He was at home when he suddenly felt chest pain. He was a health personnel himself, being a lab technician and a lab owner. So he felt he was having a heart attack. So he called his 12-year-old son, who knew little about cardiopulmonary resuscitation, CPR, and he told his son, I think I'm having a heart attack. If I lose my consciousness or something happens, please do a CPR on me. And he taught his son how to give a CPR using his both hands on his chest, and he showed. And within a minute after he said that, he had a cardiac arrest. He collapsed. And the son, even though he was tensed and anxious, he did exactly as his father had instructed. And within 3 minutes, he regained consciousness. And he could bring the patient here to the hospital. So the timely act of the son saved the father. And that too, the father instructed the son before he collapsed what to do and how to do a CPR. This shows us the importance of knowing the CPR. Sometimes it'll be our loved ones whom we are saving. Now, if anybody collapses right in front of you, you'll have to check for his airway first, and then breathing, and then circulation. That means the pulse. And then if there is no pulse and no breath, then you have to initiate a CPR or cardiopulmonary resuscitation. In CPR, you give chest compressions using both your hands in the right place in the left lower sternal region. You do 30 compressions followed by 2 breaths. And this you repeat for 5 cycles or 2 minutes. And then you reassess the airway, breathing and circulation. That's how you go about it. This is mainly for healthcare workers and people who know CPR. But if it's a lay person who does not know anything, only chest compressions are advised. At least 30 chest compressions is advised. If you cannot give breaths, that's okay. It's better than not giving anything. So what you should do is, if you're a lay person, you do 30 chest compressions and have someone else call for help, and you continue doing these compressions for 5 cycles till help arrives. So in conclusion, I want to highlight the importance of learning CPR. And this applies to everybody, every person, because one day you might end up saving your loved one's life.